telehealth. We spoke briefly on our way here about how it's, I think primarily for me it's a good, easy way, and easy is, I'm probably overusing that, but to address health disparities. What does that mean? Health disparities. It's a word that at least in modern medicine, it's a phrase I would rather say, in modern medicine that we bring up a lot. Mm-hmm. What does that mean?
Yeah, I think for me, this was a little bit kind of the realization that pulled me into the palliative care space, was what I observed clinically as a junior attending at MUSC, was that, we're a state institution and a large referral center for South Carolina. So it's very common we bring in patients from other areas and other parts of the state. And what, I quickly realized is that the level of expertise available in some communities in South Carolina wasn't at a level of best practice. That there were well-established treatments and therapies that people weren't getting just by virtue of where they were receiving care. And that seemed wrong to me, just the way it seemed wrong that we didn't have a language to talk about end-of-life issues. And so that was really what sort of started me gravitating towards health disparities.
I think especially with the progress of modern medicine, telehealth has to be a core component of how we address those health disparities and reaching out to communities that otherwise can't really afford, whether by time or by finance, to come to clinic or to come to the hospital for any sort of evaluation. And I think it's something that we really need to, as a medical community, embrace and work on making that be better and better.